In this video, we'll talk about the specific joints of the knee joint and the ligaments of that joint. So the knee joint is the tibiofemoral joint, so the tibia on the femur, largest joint in the body. It's pretty complex, even though it seems to be a hinge joint. There's actually internal and external rotation when the knee is flexed to 90 degrees. There's also the patellofemoral joint right here between the patella and the femur, and it glides along the intercondylar groove of the femur. We also have the proximal tibiofibular joint, so the joint between the tibia and the fibula. It's technically not part of the knee, but it is nearby, so we'll talk about it. Ligaments, you've probably heard of many of these. We have the anterior and posterior cruciate ligaments, or the ACL and the PCL. These are intrinsic ligaments, so they're inside the knee joint. So here we have the femur superior, tibia inferior, anterior, and posterior. The anterior cruciate ligament, or the ACL, runs from the anterior portion to the posterior portion. So you're always using the tibia as a reference for these ligaments. So let me just redirect. The anterior cruciate is blue, so it's anterior on the tibia to posterior on the femur. The posterior cruciate ligament, the PCL, is posterior on the tibia, anterior on the femur. They cross, and that's why they're called cruciate ligaments, because that means crossing. ACL is one of the most common serious injuries. It's usually non-contact, and it has some rotary or valgus forces from planting, cutting. We see it on sports like soccer, football, etc. You'd have hyperextension or a violent or a large quadricep contraction, which will pull the tibia forward on the femur. PCL injuries are not is common, and it's usually a direct contact with an opponent or a playing surface. All right, the function of the ACL. So open chain, so if you're sitting and flexing, extending your knee, anterior cruciate ligament resists anterior translation of the tibia. So if you're pulling your tibia anterior, the anterior cruciate ligament, or the ACL, will pull it in a posterior direction. Your hamstring muscle group helps out with that posterior translation of the tibia as well. Closed chain function, the anterior cruciate resists posterior translation of the femur. So for open chain, you're talking about the distal segment. Closed chain, you're talking about the proximal segment. PCL is pretty much the opposite. So open chain function of the posterior cruciate ligament resists posterior translation of the tibia relative to the femur. Closed chain function, we now look at the proximal bone, or the femur, and that resists anterior translation of the femur. Then we have some extrinsic ligaments, your lateral collateral ligament and your medial collateral ligament, or the LCL and the MCL. So on this diagram, we have our lateral collateral, because it's on the fibular side, the LCL, medial collateral on the medial side. We also have the patellar ligament going from the patella to the tibial tuberosity, and then I'm also highlighting the menisci here. So the LCL, or the lateral ligament, maintains lateral stability by resisting forces. And remember, ligaments resist tensile forces, not compressive. It's infrequently injured. The medial collateral is actually within the capsule. It maintains medial stability and resisting valgus forces, or preventing the knee from being abducted. right? So that looks kind of knock-kneed. It is commonly injured in contact or collision sports. Here on this image, you can see down inferior is the patella and the patellar ligament. So we basically dissected the patella and we can see into the knee joint. Here's the tibia. Change colors here. And these are your femoral condyles. And we can see the ACL ligament anterior on the tibia and your PCL ligament. We also see the menisci. So you have medial and lateral meniscus. They are on top of the tibial plateau. They're made of fibrocartilage. Their function is for stability, so to decrease translation, which could occur a lot because you have this round femoral condyle on a flat tibial plateau. They also lubricate the joint to decrease friction, and they provide shock absorption. You can injure either or both meniscus. They can be torn in different areas and multiple mechanisms. More about the menisci. The medial meniscus forms kind of a cushion or receptacle for the medial femoral condyle. So you can see it on this side. And here's the medial meniscus over here. So it creates kind of a backward C. The lateral meniscus is for the lateral femoral condyle. They're thicker on the outside border and they taper to be very thin on the articular surface. The medial meniscus is larger, and the lateral meniscus is almost a complete closed circle. Additional parts of the knee. You have your synovial cavity, which supplies the knee with synovial fluid, which is also decreases friction. It lies under the patella and between the surfaces of the tibia and the femur. So it engages this unit of the knee joint with the green box. The infrapatellar fat pad is just posterior to the patellar tendon, so it's right here. It is an insertion point for synovial folds of the tissue known as plica, and sometimes you can pinch those tissues, and they can be inflamed with overuse. You have bursa, which are a little shock absorption pack of liquid, and there's more than 10 in and around the knee, and they can also become inflamed, or you can get bursitis.